excited to present our two speakers. Our first speaker is Ms. Tammy Zimmeister. Tammy has dedicated 2 decades of her life to COLA's mission, serving in various roles as staff member and external advisor. While working for a physicians organization in the early 90s, Tammy became an expert in the federal CLIA law and regulations. In 1993, she joined COLA to launch the first government relations office. And in her current role as a chief innovation officer, Tammy combines her knowledge of economics, policy, business, and entrepreneurialism with her skills to guide the development of new business ideas to advance COLA's mission. Tammy is also responsible for initiating and sustaining relationships with physician organizations, laboratory stakeholders, and health plans to ensure COLA is valued and recognized as a high-quality accreditation service provider for laboratories nationwide. She received a bachelor's of philosophy in interdisciplinary studies with a focus in economics and political science from Miami University in Oxford, Ohio. She is certified as a professional in managed care by the American Academy of Hair Care Management. Our next speaker is Ms. Kathy Nusforia. Kathy joined COLA as the Accreditation Division Manager in November 2009 and served until her promotion to Chief Operating Officer in 2019. Before joining COLA, she held the position of Laboratory Advisor for the University of Maryland Medical Center Midtown Campus and Laboratory Administrator for a large multi-specialty medical clinic with over 100 providers and 30 clinical departments in Hutchinson, Kansas. Kathy created and implemented new quality processes and procedures at the University of Maryland Medical Center. In addition to managing the day-to-day operations of the laboratory, she led a multidisciplinary task force to implement molecular testing for MRSA and implemented a positive patient identification system via handheld computers and helped lead the laboratory and nursing process improvement committee. Kathy has also served as an adjunct faculty at the Community College of Baltimore County for their medical laboratory technicians program. Our next presenters is Ms. Kathy Nusforia and Tammy Zimmermeister.
Good afternoon, everyone. Can you hear me okay? I'd like to thank the One Lab Network for allowing Tammy and myself to talk about something we're very proud to be a part of, and that is the Workforce Action Alliance. So how did we get here? I'm sure you've all heard the stories about laboratories who are unable to find enough qualified staff to meet the needs of their patients. We all know that the shortage of laboratory professionals has been simmering for many years. The public health emergency seems to have exacerbated the shortage, not only among laboratory professionals, but among all healthcare professionals. We noticed several years back that in the conferences that we attend, not suddenly, but gradually over time, the workforce shortage has become a common topic at conferences. So we are at a critical juncture in the workforce shortage. There are some things that we do know. We need to know more, and we'll talk about the need to gather more data here in a minute. And although several programs for medical laboratory scientists and medical laboratory technicians have closed in recent years, some of us were surprised to learn that the number of programs actually grew modestly between 2013 and 2022. So there are a lot of questions to be asked Are there enough applicants to fill all the positions? And geographically across the United States, are there programs that have many, many more applicants than they can accommodate? There are a lot of questions that need to be asked, but the bottom line is, will the number of programs meet the need, the demand in the future for laboratory professionals? We have some really good data coming out of the Bureau of Labor and Statistics. And in that survey, they put clinical laboratory technologists and technicians together in one group. They do expect the need for laboratory professionals to grow and to outpace the need of the average need for other occupations. And that could be due to technology increases. It could be due to the aging population and the baby boomers entering the Medicare system. We've seen estimates that there are more than 24,000 vacancies for clinical laboratory professionals, and that I've seen numbers even much higher than that. And there are many additional vacancies expected to be a result of the need to replace folks who are not only retiring, but leaving the labor workforce in laboratory professionals for other reasons, whether it could be for burnout or leaving to pursue another healthcare profession or another profession entirely. And I know there are challenges with salaries among laboratory professionals. The ASCP has done some wonderful data gathering, and some things that we found out from a recent survey that they did is that 80% of the laboratories who responded to their survey have indicated that they've had difficulty in recruiting enough qualified staff over the last year. Almost 70% reported that the demands for testing was increased over the public health emergency, which makes a lot of sense. And there was also a dramatic increase in the need to hire contract staff. We also know from the ASCP survey that almost a third of those responding to the survey reported that they plan to change careers, either going to another field or retiring. And it's important to point out that the public health emergency did not only affect medical laboratories, but it had a dramatic impact on the public health laboratory workforce. Nearly 1/3 of the public health workforce reported that they were involved in the response to the nearly 1/3 of the public health workforce reported that they're considering leaving their organization in the next year. And that's pretty remarkable. 39% stated that the pandemic influenced their decision to leave the profession. So these are quite alarming statistics. So having heard over the years a lot about the laboratory workforce shortage, during our annual conference in 2022, we thought it would be a good idea to have a panel discussion about the workforce shortage. And this panel was made up of a program director, a couple of students, an employer, and a recruiter, just to talk about what are the challenges of the workforce out there, what is being done, what should be done, and what could be done. So we had a really good discussion, a panel discussion. The audience was very engaged. And at the end of it, we asked the question, what can we do? And overwhelmingly, the response was bring everybody together. Let's all work together to address the workforce shortage. So at COLA, we kind of raised our hand and decided that we would step up to the challenge. We gathered some representatives, some leaders and executives from some amazing organizations to form a planning committee to form what we have named the Workforce Action Alliance. We invited many top-level leaders and executives from laboratory organizations, from educational programs, from employers. We invited people representing high school counselors, and we invited a very sundry cross-section of professionals who have a stake in the laboratory workforce. The organizations that are represented on the planning committee for the Workforce Action Alliance include the people here you see on the screen, and they represent APHL, AAB and NYLA, ASCLS, ASCP, AABB, ASM, CDC, NSH, and COLA. So you can see we all have a vested interest in addressing the workforce shortage and have come together to try to identify what we can do together. Now, we're not the only ones working on this issue. Many of you are aware, and some of the same organizations are a part of the MPHL, the Medical and Public Health Laboratory Coalition, which is doing some fantastic work with their industry partners in advocacy for the laboratory profession. So our intent in forming the Workforce Action Alliance was not to compete with or work in silos alongside another group, but rather to cooperate and work together. So we've got people who are involved in both of these. We communicate with each other so that we can share who's doing what, share information, and work as parallel organizations toward the same goal. The Workforce Action Alliance, as the name suggests, was really intended to come up with some specific actions that we can roll up our sleeves and get to work on. So we never felt for a minute that we were working against or contradicting or duplicating any of these other organizations that are working on it. And certainly I want to recognize the One Lab Summit and the One Lab Network, because the things that they've been doing to bring together laboratory professionals in both public health and the medical field has just been nothing short of amazing. So it is a separate meeting and a summit, but we communicate with the others. We make sure that we share our results of what we've decided and what we're working on, so that we can, as an industry, hopefully address the workforce shortage. So at our next annual conference in 2023, we held our first Workforce Action Alliance Summit. It was one full day where we had approximately 65 executive level staff, people from a variety of laboratory organizations, and as I said, educational institutions, governmental institutions, and high school counselors. And the purpose was to inspire an alliance and community of practice to accelerate and replicate existing initiatives and to explore new initiatives to address the laboratory workforce shortage. And during that summit, we heard some wonderful initiatives that have been undertaken at some educational facilities, and we brainstormed about how we can build on what they're doing and move forward to address the shortage. These are some of the topics that were discussed at the summit. We broke up into different groups, and as you can see, we addressed a wide variety of topics, recognizing that we can't undertake all of the obstacles at once that are out there, and we can't solve this overnight. But we thought what we can do is select a few initiatives or priorities that we can start working on over the next 12 months, and then come back together to either talk about continuing them or develop other things that we can do. So at that summit, at the end of the day, we came up with 3 priorities that we wanted to work on together. One of them is about strengthening the data, and you'll hear about that in a minute. We've got a lot of good data, as I have said. We've got data from NACLS, we've got data from the BLS, we've got good data from ASCP and other places, but we need more data, trending data, and we need more data to help us advocate for our profession among policymakers, so that educational institutions understand and communicate with us about the needs. And there's just some data that we need more of, and I'll talk about that in a minute. The second priority that you see on there is working together to communicate career paths. This is a big deal. I'm sure you've heard over and over at your facilities about, you know, my daughter, my cousin, my niece, nephew they're not even aware of what careers are available in laboratory science. So it's kind of a cliche where we call ourselves the unsung heroes. There are a lot of unsung heroes in healthcare, but the laboratory professionals aren't real well known among people who are choosing their careers. And that's really a shame, because it as we all know, I'm preaching to the choir, an extremely rewarding career in laboratory science. It is out there and available, but perhaps the message isn't getting to all the right people who are making decisions about their careers. And you'll hear from Tammy in a little bit about all the wonderful things led by Chris Bean, who you just heard from, all the wonderful things they're doing to communicate the potential career paths for new and transitioning professionals. And finally, we've recognized over the years that there is some confusion out there about what we call ourselves. We've got a lot of different terms, and we decided to talk about how should we refer to laboratory careers so that across the board people know who we are and what we do. So each of the work groups for the initiatives was assigned a leader. Dr. James Crawford, who I'm sure many of you know, is the leader of the first work group over the last year, and the goal was to strengthen the data to understand the laboratory workforce. What they've accomplished already is absolutely amazing, because we did have a representative from NACLS on that team, Marissa James. And what we were able to do is put our heads together. The team put their heads together to add some questions to gather additional information on the annual NACLS survey. Now, I understand that that data will be shortly available, hopefully at the time of the next summit. Our annual summit for the Workforce Action Alliance will be May 7th. If not, shortly thereafter, we'll get some information, and then we can look at that data to see what does it tell us, how are things changing over time, and what additional information can we provide to policymakers to help get some support for our profession, whether it's in the form of tuition reimbursement or loan forgiveness or grants or things like that to help make our profession that we all love so much more attractive to young people and transitioning students. So strengthening the data will help with advocacy and evaluating the effectiveness of their investments. And we're real eager to hear a report out from each of these groups at the summit that's coming up on May 7th. Now, at this point, I'm going to hand it over to my colleague, Tammy Zinsmeister, who has participated along with Chris Bean, who you've just heard from in this. This turned out to be a large undertaking, and they've just done some amazing work. So Tammy, I'll let you talk about the Career Pathways Initiative.
Great, Kathy. I'm trying to start my video here. It says the video cannot start because the host has stopped it. Give her a second. Oh, there we go. Thank you very much. Kathy, thanks for the opportunity to join you today to talk a little bit about this particular initiative, communicating career pathways for new and transitioning professionals. I've been participating in this group since last May with Christine Bean, who's just been a wonderful collaborator and leader on this particular initiative. We actually gave everybody the opportunity to sign up to work on some of these initiatives. And we had 30 people decide that they wanted to participate, which was essentially half the group that attended the summit, that were excited about being a part of this. We had certainly laboratory science professionals, we had educators sign up for this particular initiative. In addition to COLA, other accrediting organizations joined this particular initiative. We had recruiters, certainly led by Christine, and other public health leaders came on board to work on this particular initiative. We had CDC participate with us, and also several employers. So it was just a great group. At the actual summit, each of these initiatives, we developed action plans. As Kathy noted, this group is about action, getting things done. And we've decided that in May, when we come together here just in a few weeks, we'll look back in the morning of our summit and say, well, how much did we get done? because it really is a measure of our success, and the value of coming together for that day is really about, did we accomplish what we wanted to accomplish? This particular group, because it was so large, I worked with Chris and Edna Garcia was on this as well as Amy Sitska, to try to look at maybe we needed to divide this group into some smaller groups. That helps with scheduling. And it also assisted us in kind of getting more strategic around some certain areas of focus that we wanted to have. So this group actually formed into 4 subgroups. One subgroup was really focused on raising awareness of careers in laboratory science, specifically with high school students. We also had a subgroup that formed out of this group called Academic Partnerships, which is really focused on strengthening connections between laboratory professionals and on-campus academic advisors and career counselors. We had a subgroup, and Chris kindly led this subgroup as well, that would really work on visualizing career paths. And it's really thinking about both the educational requirements and certifications that might be needed for various career paths, and also looking at the breadth and depth, thinking beyond traditional paths within a career, but actually looking where you might be able to branch and take a totally different direction. So kind of broadening the view and looking at the breadth and depth of all the careers that would be available with a laboratory science focus. And also looking at those career paths from the perspective of guiding people that are already in their career. Maybe they're mid-career, maybe they're moving into kind of the last season of their career, but the opportunity to look at what might be next for them. This particular subgroup also looked at some retention, which we're going to pick up at the upcoming summit. I appreciate what Chris was saying earlier about the importance of well-being, creating environments where people can really thrive, not overworking, having boundaries, is all part of successful retention strategies. So we'll be picking that up in May for further discussion. And then there was a subgroup that was focused on funding in terms of scholarships, loan forgiveness programs, et cetera, for students, and also looking at funding for educational programs to basically build their programs. So let's start with this first subgroup. Kathy's already pulled that slide forward. This has been, what can I say? This has been a very passionate group of people. I think if there's one thing that gets laboratory scientists excited is to go out and talk to the next generation. We've had a lot of really great discussion about how to reach out to young people effectively. Certainly, conferences is a big part of that. ASCP, who we've talked a lot with about conferences, actually attended the American School Counselors Association meeting last year in 2023. And one of the things they discovered is very few high school counselors are aware of the laboratory science profession. So they want to go again this year, and through our collaboration within the Workforce Action Alliance Summit and the Medical and Public Health Laboratory Coalition, there are a couple of organizations that will be going with ASCP. COLA is one of them, to attend that national event. We've also found that people on this particular subgroup have actually attended the state chapter meetings of ASCA, which is a really great opportunity. And then we also worked with a member of our subgroup on identifying other opportunities, other meetings to reach out to, because it's great to reach out to school counselors, but we need to reach out to administrators, superintendents, science teachers, school boards, STEM festivals. It was also recommended by one of the people on our group that particularly in some of the rural areas, reaching out to the public library is a great place to go and talk with the librarian about how we can engage young people in the career. Another thing that we've talked a lot about in this group is site visits. So often we think about trying to arrange those at hospital employers in the area. So you introduce the young people, you want to take them to see a laboratory. There was hospitals have opened their doors to that. COVID did create a lot of limitations on that. But the other thing that maybe people don't think about is to actually take student groups to your local public health laboratory. So we've had the opportunity to learn through Denise Tooney about how to do that effectively. And she's been a great addition to the team. She's from Virginia and she is part of the public health laboratory there. She's just a tremendous and valuable member of the team. The second thing that we're working on is a virtual toolkit. So a lot of organizations, well, I would say a number of professional organizations at the national level have created tools for how you would engage and do outreach with high schools, but we're not sure that those are readily available to everyone. So the idea here is to actually create a toolkit, and these would be things in that would be things like template letters to your local principal of your high school. It would be slide decks that would be ready to be available if you're a laboratory professional and you just want to go into a school, you just take your own initiative, you would at least have a starting place. Guidelines for arranging tours, things like that. So all the tools that you might need to take initiative in your community is really what we mean by the virtual toolkit. So we're working on that. And then we're also looking at ways to reach what we learned, and Dawn Taylor, who's on this subgroup, and a few other people have learned, is that there are these career readiness platforms. Cello, Gladio, Work Tour, these are platforms that educators and school counselors and students use to assess kind of aptitude, interest, would a student thrive in a particular environment? And what we've learned in talking with some of those career readiness platforms is that they don't have a very robust area to really convey a profession in laboratory science. And some of the platforms don't even have it on their list. So the idea is we may be able to reach more students through these types of platforms. So we'll be looking at that as well in our year 2 of activity. And then we've been trying to look at data around where are some of the really underserved communities. And we found a great database through the Department of Education that will allow us to really look at how do we reach some high schools that maybe aren't necessarily touched with these types of opportunities that we could reach out to based on need and really get some information out about the career in laboratory science. I think the Strengthen the Data group, when they come back and maybe they can help us pinpoint some communities that are maybe don't have enough students applying for the programs there. That might be an opportunity to use that information to maybe go and look at some of the high schools and be strategic and targeted about reaching out to those groups. So again, a lot of enthusiasm in this group, and I'm pretty sure this group is going to continue another year and pick up where we're leaving off this year. Next slide, Kathy. The next group is academic partnerships, and primarily this is a smaller subgroup. It's primarily the educators that are working on this, and they are looking at how they can get more information from the career counselors and scientific or academic advisors on campus, particularly within their school, their college or university, to see how they can create better connections and bridges between laboratory professionals, their programs included, and the on-campus counselors and advisors. So that is a smaller group working on that. It's a very important group, and they're working on trying to create those bridges. Next slide, Kathy. The funding subgroup. So the funding subgroup is really looking at a couple of things. One is, where can we identify scholarships and loan forgiveness programs for students? So that's a big part of it. They've generated a list. There's about 6 people working in this group, and they've generated a list of those opportunities, and we'll be figuring out where we can house that. How do we get that disseminated? How do we keep it up to date? And also, there are a couple of people working on where is funding for educational programs specifically. We did hear at the summit last year that some state legislatures are funding investments in medical, in laboratory science, and certainly where there's a push at the federal level within Congress to try to get some additional funding to try to support the investment in either scholarships, additional funding for loan forgiveness programs, or other things to try to help the profession grow its profession in the coming years. And then we are also looking at the HRSA grants. Up until this point, HRSA grants have not been available to allied health educational programs. But there is an initiative in the Senate to try to put some money in that particular grant option that would allow allied health, which would include laboratory science, to actually apply for grants for their community to strengthen their programs or expand their programs. Next slide, Kathy. This is the fourth of the subgroups, and Christine, as I said, has been leading this with some other people that are participating. And this group's really been trying to do an inventory of all the kind of resources that are out there that really showcase the pathways. There are a number of organizations that have those things already going. And, looking to see if we can think about it holistically. And, we have public health putting some great information out there. You have ASCP and ASCLS putting great information out there, as well as some of the specialty professional organizations. But what is kind of the unified, if you were to create one thing that somebody could look at and say, wow, there's a lot of opportunity in this profession. How do we kind of pull it all together? They are also working on a webinar where they're going to be highlighting career pathways, so inviting people that are in their careers to have in a webinar / podcast to share their path, their journey, and to offer that webinar to STEM leads at colleges and universities. I think is a great way to do that. And then there's a small group of us, it's basically me and a couple of other people trying to inventory and look at what are some of the existing retention strategies. And also to look at that across generations, because what might be important in my generation is one thing, but what might be important in another generation that follows my generation, they may value other things. So being mindful of, depending on how long you've been in your career and your worldview in terms of what you grew up with and the environment that you were in, you may have different things that are more important to you than what I value. So having some appreciation, and certainly you hear the theme of work-life balance with the generations that are, the X and the Y, but I think we're also seeing it in the baby boomers as well, how important work-life balance is. I think that's something that we all share across the generations. And so I think that it's really good to look at it from that perspective. Next slide, Catherine. This is some great work. If you're not familiar with What's My Next, ASCP has a great website. I would encourage you to look at that, where they actually are building and making available information for people within the profession, people looking at the profession, as well as educators. And I just think it's a great site. And the next slide, please. And of course, Christine and the amazing work that APHL is doing around really promoting fellowships. And this is on the funding side. As well, in terms of fellowship programs and internship programs. And since I started doing a lot of research on this, and I've been following all of this on LinkedIn, there's so many great initiatives out there that we can learn from and that we can help others, maybe through the virtual toolkit or just in getting the word out of what other people are doing. There's just amazing initiatives underway that are happening. By professionals such as yourselves to grow the next generation. Kathy, I think that's it.
Thank you, Tammy. That's really exciting. My hat's off to you and all of those sub teams who are doing such great work. So the third initiative that we undertook was about how do we call ourselves? What do we talk about when we talk about careers for laboratorians? We mentioned a little bit earlier that there are 30,000 vacancies at any given time in laboratories. And the pipeline of the schools, some 600 programs, there's approximately 9,000 new professionals coming out every year. And if you look at what would be the normal rate of attrition due to retirement, we're barely keeping up with attrition from retirement. That does not account for people who are leaving the profession for other reasons, for burnout or whatever. And it doesn't account for the expectation that the demand is going to grow. So we talk a lot about different ways to attract people to the profession. And there's been a lot of controversy and I might add some confusion about who are we? What do we call ourselves? So as we had these discussions at the summit, we talked about how do we refer to ourselves, and we used the example of nursing. So a high school student or a college student may decide, I'm going into nursing. And everybody knows basically what that is. And everybody also knows that there are various levels of professionals under nursing careers. There's RNs and LPNs, there's school nurses, there's cardiac nurses, there's emergency room nurses, pediatric nurses, a lot of different variety of careers under the umbrella term of nursing. So what we wanted to do with this group is to strengthen our profession's standing and solidify how we refer to ourselves to eliminate confusion amongst young people who might be trying to decide their careers. So this was the aim was to elevate the public awareness of our overarching profession. Now, this was never meant to contradict any of the good work that's been done by other organizations to name our credentialing, whether it's medical laboratory science or clinical laboratory science. We didn't want to come up with something that would further add confusion. And I might add that this team, there was also a lot of passion. There was a lot of discussion and a lot of opinions, some other suggested terms that came up. But in the end, we decided that whatever we use to call our profession, we didn't want it to be something that conflicted with the good work that's already been done. So in the end, we decided that we would like to promote laboratory science careers as kind of an umbrella term, an overarching term that would be inclusive of public health, of medical laboratory professionals. And we listed up there several of the things that you can do as a laboratory science career. Couldn't possibly put them all up there. But we shared this information with the other work groups, and we would like to promote the term laboratory science as an umbrella term for this type of career, knowing then that students can choose to be more specific. They can go to school for 2 years or 4 years or 6 years. They can specialize in chemistry or biology or whatever it is. They can work in public health. They can work in medical laboratories. But we want the younger generation and people who are looking for new careers to understand what we mean by laboratory science careers, kind of similar to the way we talk about nursing. So again, this is meant to be inclusive of all the different career options that are available. And we will use it, for example, with when we speak to high school counselors. They talk about careers in nursing. We want to encourage them and provide them with good information about careers available in laboratory science. This was never meant to conflict with or undermine other credentialing terms or terms used by states for licensure reason. So the term medical laboratory scientist or clinical laboratory scientist, it all fits. It's the last thing that, I think we would have been, probably taken a step backwards if we came up with some term that kind of didn't really fit with the good work that's already been done. So after a lot of discussion and a lot of alternatives being brought up, we want to promote the term laboratory science to describe our careers. I just put a snapshot up there because you may have seen these articles. There's just a lot of good work published by these organizations. about how to call our careers, and the reason, why would we want to do this? Again, because it's just, if you're a high school student trying to choose a career and you have all different kinds of names out there and you're not sure what's what, we kind of think that could be a detractor. Now, one of the challenges that we've got at the Workforce Action Alliance is sustaining our efforts, because there have been some very good efforts started in the past to address the laboratory workforce shortage that have done some really great work but haven't been able to continue. So we've committed to doing a couple of different things. We do publish what we call a proceedings document that documents everything that we did, everything that we decided, and when we follow up everything that we've accomplished, what we want to continue. So we're going to document our activities so that it holds us accountable. We don't want this to be something that we start and can't continue. So that's why there are many committed and enthusiastic organizations participating in the Workforce Action Alliance. It can't be the work of one organization. It's not about one organization. It's about all of us working together. So you can find the proceedings document at the website listed there, and I believe that was also sent out. We will also publish a proceedings document following our second annual Workforce Action Alliance Summit that will be held on May 7th. And it will be in Destin Fort Walton Beach in Florida. We have held our Workforce Action Alliance Summit kind of adjacent to our annual education event. And it's kind of obvious as to why we would do that. Planning an on-site meeting and gathering people together is a whole lot of work. So to add the Workforce Action Alliance Summit just before our educational event makes it easier on everyone as we book hotel blocks and reserve rooms and things like that. So I think that's the end of our slide presentation, and we're doing really well on time, so we can open it up to questions.
Thank you so much. Again, we'll take this a few minutes to answer as many questions as possible. If we do not answer your question today, we'll do our best to respond via email. If you didn't submit your question anonymously, if you have any questions after today, please email onelab@cdc.gov. Okay, let's get to the first question. What do you think the current methods used for measuring and monitoring our workforce? And this one has like 3 parts to it. They want to know also if there's some validity issues, if the data sources were already have more effectiveness. So I think they just want to know, like, what do you think the current measures used to monitor the workforce?
Yeah, so there's some good measures coming in. We've mentioned the ASCP vacancy survey, which I believe is out there now, and I would encourage anyone to share that link with your colleagues at laboratories, because the more data we get, the better it is. NACLS always provides good data. The Bureau of Labor Statistics provides good data, but we can improve on it. For example, we don't have a lot of good information about the number of laboratory professionals that are coming in from degrees other than MLS or associate's degrees. We've got people with degrees in chemistry and biology. So we've got a lot of good data, but we can do better. We've also met with a group out of a group that collects data from hospitals, and they're willing to share their data with us. So we want to try to get as much data as possible. But the data that's out there, I have nothing bad to say about the good people who have collected all this data over the years. It's amazing that they've done this. We just need to look at it a little deeper, decide what does it mean, how is it trending, and what are we going to do about it?
Great. This question, they want to know, do you think that the decrease in the lab fees by health plans paid to clinical labs paid to clinical labs affects the opportunities of salary raise and leads to lab scientist shortage?
Well, it certainly doesn't help. So we've all, been advocating for to stop the decreases in the clinical laboratory fee schedule, and it's no secret that salaries are an impediment or a barrier to getting a lot of good people to choose careers in laboratory science. So somewhere we've got to square those things. Reimbursements being cut and not having enough money to pay our professionals, that's a tough one to tackle. But I would say the short answer is yes. I do think that the decrease in laboratory reimbursement is going to make it difficult for, and I understand the challenges of health systems and hospitals. They have a budget. I get that. But it is going to make it difficult for us to overcome the salary deficits that are there for laboratory professionals when you take into consideration the degree of education that we have. It's gonna make it difficult for sure.
This is a good one. Will strengthening the data help lead to increased options for education programs? As far as they can tell, Oregon only has two options. One is an MLS for a 4-year program and the MLT 2-year program for the entire state. They really struggle with how they should advertise this career to high school students when there's no path for them to go into this career.
Oh, what an amazing piece of information there about Oregon. I didn't know that. But we hope so. We hope we can glean some more data about where geographically the programs are and where the programs get more applicants than they can accommodate and where they don't get enough applicants, because we have a mix of those situations. So hopefully if we can provide enough data, we can convince educational institutions of the need for laboratory scientists. We've also talked about, and we're nowhere near a solution on this, but we've also talked about a possible reciprocity type or agreement, so that if there are more students than there are slots in the programs in one area, but another area doesn't have enough students to fill their slots, that maybe we can arrange some kind of reciprocity to get the students to where the programs are. But yes, that would be our hope, that we would have better data to show educational institutions the demand for laboratory science professionals.
Great. This is something that we experience on our network calls, is with international graduates asking for more resources. And this one is actually saying he actually wanted to know, why not source for laboratory scientists and technicians outside of the US? Nigeria has a lot of young graduates looking for jobs. And so I know that's a huge challenge.
Yeah. We did have an organization called PAMET participate in the Workforce Action Alliance Summit, because there are a lot of really good laboratory scientists coming over from the Philippines. And what can the success of that program be? What can we learn from that to help other professionals in other countries? So we haven't gotten to that level to where we've been discussing other countries, but we are interested in knowing what the situation is in other countries and how can we match the two. Tammy, do you have anything to add to that?
The only thing I would add is there are a couple of people that are in the Alliance that have talked about the visa program. We're, understanding a little bit more about how that works. And seeing, and I think this will apply to not just laboratory science, but all the healthcare professions, about how do we open it up so that people that have the qualifications and want to come here to work would be able to do that. My understanding of that, from what I've heard, is that it's a little bit of a backlog getting those visas through for people to be able to do that. So yeah, I think it's probably an opportunity for sure.
Yeah, thank you for the question.
Yes. And I had saw someone in here dropped some Puerto Rico's kind of having a similar issue. This is an interesting one. Let's see. What, if any, thought has it been, hold on, this keeps moving, given to create a unified tracking database of our professionals? Evidence has shown that the BLS and OEWS database have validity issues surrounding their collection and reporting of data for allied health professions. So I guess the question is has there been talk about having a unified tracking database for the professions?
I don't think so. Tammy, are you
The
aware?
only thing that I'm aware of with regard to BLS is that because of the combining the 4-year and 2-year into one category in terms of careers does kind of distort the data. There is an effort by some of the national professional organizations that are meeting with BLS to try to make sense of that. I think it's going to be a great conversation for the summit in May in terms of understanding what kind of progress can be made on that. But I haven't heard anybody that's involved in that talk about starting a new initiative to collect that would result in a unified tracking database. It's an interesting idea. We can certainly pass it along. And I'll Kathy, we can make a note of that and talk a little bit with Jim about that.
Yeah.
So I think what they're suggesting is there just an opportunity for somebody to start to gather that information. I don't know who that somebody would be, but I think what they're saying there is maybe the profession shouldn't rely on others and should start to look at gathering its own information, not to take away from what ASCP does and others. I see the point about in the questions that it may not be frequent enough or have enough of the that's needed to really make policy decisions. So it's what's noted here in the Q&A. So yeah, thank you.
You're welcome. We'll take one last question. This person says, from personal experience, I've seen that they haven't seen many jobs for entry-level new laboratory science professionals. Has this been addressed at the meetings within your organization?
Well, we have talked about the fact that it's not uniform across the board. I have heard that a lot of the openings in some of the, we've heard that there's a shortage in rural areas and there's urban deserts. And then we've heard about some areas where if you're a new laboratory science professional coming out and you're looking for your first job, that sometimes the jobs that are available are on the night shift, which I've worked the night shift. I think we've all worked the night shift at one time or another. So I think it varies depending on the location and where you are. But we hear quite the opposite, not only from our laboratories and from the people participating in the Workforce Action Alliance, that they can't find laboratory professionals to fill their job openings. So maybe we need to dig into why that is, or there could be areas where I know at one time, I worked in Kansas for quite a while, and in Kansas, we didn't feel the workforce shortage like the rest of the country was until now. I hear they're feeling it now. So it could be that it just fluctuates and varies from one part of the country to another. So it's not a uniform thing you might find. And I think we could probably get some data on that from the ASCP vacancy survey. You can probably tell what areas of the country have more vacancies than others.
Great. Thanks, Kathy and Tammy, for sharing great data. And I'm excited for the work that COLA is doing, commitment to helping address the laboratory workforce shortage. Now we'll turn it back over to Blanche.